It is 2:07 a.m. and the house is silent except for one wet, repetitive sound. Your dog is curled beside the bed, licking the same paw again and again. You switch on the light, gently lift the foot, and expect to find a cut, a thorn, or something obvious. But at first glance, the skin looks almost normal. That is when the worry starts. Is this just grooming, or is your dog trying to relieve itching, pain, or irritation you cannot see yet? The mistake many caring owners make is reaching immediately for vinegar, oil, cream, or whatever remedy appears first online. Before you apply anything, the safest first move is simpler. Stop the licking long enough to inspect the paw calmly. Repeated licking can turn mild irritation into raw, inflamed skin, so interrupting access matters. A properly fitted recovery collar may help while you look closely, and one observation can quickly narrow the possibilities. Is your dog focused on one paw or licking several? Before searching for the cause, you need to know when ordinary grooming becomes a warning. A few quick licks after a walk, a meal, or a muddy trip outside can be normal grooming. The concern begins when the behavior becomes repetitive, lasts for several minutes, returns night after night, or is difficult to interrupt. At that point, the licking is no longer just cleaning. It may be a response to itching, irritation, injury, infection, pain, or stress. That distinction matters because paw licking is a sign, not a diagnosis. The same behavior can come from very different causes, and the safest response depends on what else you notice. Is the dog licking one paw or several? Did it start suddenly? Is there redness, swelling, odor, discharge, staining, a broken nail, or limping? Do not wait through the rest of the video if the paw is bleeding heavily, severely swollen, burned, visibly punctured, or your dog cannot place weight on it. Those signs need prompt veterinary attention. For everything else, the goal is simple. Identify the pattern before guessing at the cause. The clock alone cannot diagnose the problem, but what happens around the licking can reveal where you should look first and what to do. The fact that the licking happens at 2 a.m. feels important, but the time alone does not reveal the cause. Night may simply be when the house is quiet enough for you to notice it, or when your dog is resting without distractions. The useful clues are what happens before, during, and after the licking. Start with distribution. One paw points you toward a local problem, such as a torn nail, small injury, trapped debris, or deeper pain. Several paws make a broader, itchy skin pattern more likely. Next, look at onset. Did the behavior begin suddenly after a walk, or has it returned for weeks, months, or the same season each year? Then inspect the paw itself. Compare it with the opposite paw. Look for redness, swelling, staining, odor, discharge, broken nails, or tenderness. Also notice whether your dog is limping, rubbing the face, scratching elsewhere, or having recurring ear trouble. Brief grooming that ends on its own is different from licking that resumes the moment you interrupt it. Record a short video and note the timing, duration, recent walks, new products, and which paws are involved. These details can reveal much more than the clock ever could. When several paws are involved, itching moves much higher on the list. When several paws are involved, especially alongside face rubbing, itchy ears, or a pattern that returns during the same season, allergy moves higher on the list. The skin may still look almost normal at first, which is why many owners miss the connection. Environmental allergies can be triggered by things such as grass, pollen, dust, or other particles that contact the skin. Contact irritation can also follow exposure to lawn treatments, cleaning products, or rough surfaces. Notice whether the licking increases after walks, after time in the yard, or during certain months. A gentle rinse with plain water after outdoor exposure may help remove material left on the paws, but it does not diagnose the cause or cure an allergy. Food allergy is where owners often jump too quickly. Paw licking alone does not prove that chicken, beef, grain, or any single ingredient is responsible. Environmental allergy, infection, parasites, pain, and contact irritation can create a similar picture. Randomly switching foods every few days can make the pattern harder to understand and may upset your dog's stomach. A reliable food allergy investigation usually requires a strict elimination diet followed by a controlled reintroduction under veterinary guidance. That takes consistency, not guesswork. So look for the broader pattern: several paws, recurring ear trouble, face rubbing, seasonal flare-ups, or itching elsewhere on the body. Those clues make allergy more plausible, but they still do not confirm it. Take a clear photograph before cleaning the paw and track when episodes occur. A consistent record can later help your veterinarian separate recurring exposure from a one-time injury. If the licking began suddenly after one walk and only one paw is involved, inspect for something physical before blaming the immune system. Sudden licking of one paw tells a different story. If the behavior began after a walk, a run through tall grass, or time on hot pavement, think local irritation before assuming allergy. A thorn, splinter, foxtail, shard of glass, torn nail, pad abrasion, or small object trapped between the toes can make a dog focus intensely on one spot. Use bright light and compare the affected paw with the opposite one. Check the top, the pads underneath, the spaces between the toes, and the edges of every nail. Look for swelling, punctures, redness, a loose nail, surface debris, or a place your dog pulls away from when touched. Limping, holding the paw up, or refusing to walk adds weight to the possibility of injury. If you see loose dirt or minor surface debris, a gentle rinse with clean water may help, but do not squeeze the paw, dig into a puncture, or pull at anything deeply embedded. Foxtails and similar plant material can move farther into tissue, and broken glass or splinters may cause more damage when removed incorrectly. Those cases need veterinary attention. Be careful while handling a painful paw. Even a gentle dog may react defensively when something hurts. If the licking began suddenly, stays focused on one paw, and returns immediately after interruption, treat that pattern as useful information. That is where inflammation and infection enter the cycle. But when nothing appears stuck and the paw begins to smell, stain, swell, or ooze, the licking may already have created a second problem. Sometimes the original problem is small, a little irritation, a tiny scrape, or an itch that starts after a walk. But repeated licking changes the paw's environment. Saliva keeps the skin damp, friction weakens the surface, and tiny breaks in the barrier make it easier for bacteria or yeast to multiply. The result is a cycle. Irritation causes licking causes more inflammation, and the worsening skin creates even more irritation. Look for changes that were not present at the beginning. The paw may become red, swollen, greasy, scaly, or tender. Hair can thin around the toes. You may notice discharge, small bumps, reddish-brown staining, or a stronger odor. Those signs raise concern for infection, but they do not tell you which organism is involved. A corn chip smell is often discussed online as proof of yeast. It is not. Odor can accompany yeast or bacterial overgrowth, but identifying the cause may require a veterinary examination and tests such as cytology, skin scraping, or culture. Avoid pouring vinegar onto raw skin or treating every smell with an antifungal product. If the skin is open, irritated substances can sting and delay healing. And even when infection is present, the original trigger still matters. Allergy, trauma, parasites, moisture, or pain may keep the problem returning unless that cause is addressed. Before adding another possible diagnosis, pause and compare the pattern you have seen so far. Several paws suggest a broader itch. One paw suggests a local problem, and odor, swelling, staining, or discharge tell you the skin may now need closer veterinary attention. At this point, do not diagnose the paw from one clue. Focus on 4 details: how many paws are involved, how suddenly the licking began, what the skin looks or smells like, and whether your dog is moving differently. Several paws, ear trouble, or seasonal flare-ups can support a broader itchy skin pattern. One paw after a walk may point toward a thorn, torn nail, burn, or local injury. Odor, swelling, staining, discharge, or hair loss raise concern that inflammation or infection has joined the problem. These clues guide your next step, but they do not confirm a diagnosis at home. A paw that looks normal can still hide parasites, deeper pain, or a repeated behavior that developed for another reason. Parasites are often blamed for every itchy paw, but their pattern matters. Fleas usually create irritation around the lower back, tail base, and thighs, especially in dogs allergic to flea saliva. Severe itching can spread, yet one suddenly irritated paw is not the classic flea pattern. Ticks, mites, or other localized irritants can still affect the feet, including spaces between the toes. Check carefully for attached ticks, small bumps, crusting, or areas your dog guards when touched. If you see something embedded and cannot identify it confidently, do not squeeze, twist, or cover it with concentrated oils. Improper removal can leave material behind or make the area more inflamed. This is also where kitchen solutions can create false confidence. Brewer's yeast, vinegar, garlic, and essential oils are often promoted online as natural parasite protection, but they should not replace veterinarian recommended prevention or diagnosis. Some products can irritate the skin, and some ingredients may be unsafe for dogs. Parasites may also exist alongside allergy or infection, so finding one clue does not automatically explain the entire problem. Persistent licking still deserves investigation, especially when redness, odor, discharge, or hair loss continues. If parasite signs are absent and the paw still looks normal, the source may sit deeper beneath the skin, or the licking may have become part of a repeated behavioral cycle. A paw can look completely normal and still hurt. That is why persistent licking should not be dismissed as boredom simply because you cannot see redness, swelling, or a wound. A cracked nail, sore joint, soft tissue strain, nerve irritation, or deeper inflammation may cause a dog to focus on one area again and again. Watch how your dog moves before you touch the paw. Are they slow to stand, shifting weight, avoiding stairs, hesitating before jumping, or pulling away when you handle the leg? Those details matter. The licking may be your dog's attempt to soothe discomfort that is coming from beneath the skin rather than from the skin itself. This is also where owners often make the opposite mistake and label the behavior as anxiety too early. Stress, frustration, understimulation, or compulsive habits can contribute to repeated licking, but behavioral causes should usually be considered only after pain, allergy, infection, parasites, and other medical problems have been investigated. Chronic licking can eventually create a thickened, irritated, or ulcerated patch, sometimes called an acral lick lesion. At that point, the behavior and the skin damage begin reinforcing each other, even if the original trigger was physical. Nighttime does not prove a psychological cause. The house may simply be quieter, your dog may be resting with fewer distractions, or discomfort may become more noticeable when activity stops. Record when the licking starts, what happened earlier that day, how long it lasts, and whether movement has changed. A short video can help your veterinarian see the pattern. Do not punish or redirect your dog without investigating why the behavior keeps returning in the first place. Whatever the cause, the safest next step is the same. Prevent more damage, inspect carefully, document what you see, and decide how quickly professional care is needed. When your dog will not leave the paw alone, the goal is not to diagnose everything at home. The goal is to stop further damage, gather useful clues, and choose the safest next step. First, interrupt the licking. Stay nearby and redirect gently. If your dog keeps returning to the paw, use a properly fitted recovery collar if one is available and your dog can tolerate it. A collar protects the skin, but it does not treat the cause. Second, inspect the paw under bright light. Compare it with the opposite paw. Check the pads, the spaces between the toes, the nails, and the skin above the foot. Look for swelling, redness, punctures, discharge, broken nails, trap debris, or pain when touched. If handling causes distress or defensive behavior, stop immediately rather than forcing examination at home. Third, clean conservatively. If you only see minor surface dirt and no deep wound, rinse with clean water or saline. Then dry the paw carefully. Do not apply peroxide, rubbing alcohol, essential oils, vinegar, random creams, or human pain medicine. Avoid tight homemade bandages that can trap moisture or restrict circulation. Fourth, document the pattern. Take a clear photograph and note which paws are involved, when the licking began, what happened earlier that day, and whether you notice limping, odor, discharge, or repeated ear and skin problems. Fifth, choose the right level of care. Brief grooming without injury may be watched. Persistent licking deserves a veterinary appointment. Swelling, discharge, open sores, obvious pain, limping, or suspected foreign material need prompt attention. Heavy bleeding, severe burns, deep punctures, major trauma, or inability to bear weight should not wait. The safest home plan is simple. Block the licking, inspect gently, clean only when appropriate, record what you see, and escalate when the signs demand it. Some paw problems can wait for a routine appointment. Others should not wait until morning. The difference comes down to severity, progression, pain, and whether your dog can use the limb normally. Arrange a routine veterinary visit if the licking keeps returning, continues for several days, or comes with staining, recurring ear trouble, or repeated skin flare-ups. Those patterns suggest an underlying cause that needs more than temporary interruption. Contact your veterinarian promptly if you see swelling, discharge, a strong odor, an open sore, worsening redness, a broken nail, obvious pain, limping, or suspected foreign material. These signs may indicate infection, injury, or something embedded that should be examined professionally. Seek urgent care for uncontrolled bleeding, a deep puncture, a severe burn, major trauma, rapidly increasing swelling, or an inability to bear weight. Marked lethargy, fever, refusal to eat, or sudden worsening also raise the urgency. Puppies, frail senior dogs, and dogs with chronic medical conditions may need attention sooner because they can deteriorate faster. When uncertain, call and describe the signs. Once you know which category fits your dog, the late-night licking becomes useful information instead of helpless panic. You do not need to identify the cause at 2 a.m. What matters is recognizing patterns, preventing damage, and knowing when professional attention is needed. Brief grooming is different from repeated licking. One paw suggests a different starting point than several, while swelling, odor, discharge, injury, or limping changes the urgency. Missing the cause does not mean you failed your dog. Calm observation is responsible care. Does your dog lick one paw or several, and does it happen after walks or mainly while resting? Subscribe for evidence-led dog health guidance.